She's a real woman with a real life. She's someone you can relate to. Dawn Newton.
Hey, welcome to the Dawn Newton Podcast. I am your host, Dawn Newton. Joining me today is Dr. Julie Taylor. She's a sought-after public speaker on hormones and women's health. She's here today to talk about her new book, The Hormone Manual, a straightforward guide for every woman at every stage of life. In the book, Dr. Taylor clearly shows why, in matters of physical health, mental health, and total well-being, hormones are everything, covering every stage of a woman's life from childhood to puberty, from pregnancy and motherhood to menopause. Dr. Taylor gives her readers the knowledge and power to understand the role of hormones in not only PMS, baby blues, and hot flashes, but also in sleep issues, panic attacks, anxiety, depression, arthritis, dementia, and more. Dr. Julie Taylor, it's a pleasure to speak with you. We're talking today about your book, The Hormone Manual, straightforward guide for every woman at every stage of life. I appreciate this opportunity to talk with you and the work that you've done. Thank you.
Thanks so much for having me, Dawn. It's a pleasure to be here.
Absolutely. We talk about hormones, and I think one of the perceptions, and not that it's an accurate perception, but I think when we hear about hormones, we just think women, we think menopause, that it's just estrogen. And there's so much more to that than just women, estrogen, menopause. From birth to death, we're dealing with our hormones.
Yeah, that's right. It is very complex and complicated. The system is a complex one, and just, everything working together is very important. And typically we do think of estrogen as being, the female hormone and testosterone being the male hormone, but really we make all the same hormones just in different quantities and concentrations. Progesterone is a huge hormone that I don't think gets enough attention. That hormone, tends to fall early on in our early 40s and really can lead to anxiety and depression and difficulty sleeping and really all the things that women tend to come in for when they feel like things are not going right. So progesterone is so key, and that really helps to balance out estrogen and, again, just help you to feel stable mood-wise. And then testosterone is really the other really key hormone that doesn't get enough attention. And for women, when we lose our testosterone, we're really, our muscle mass declines, our energy, our motivation, all of those things that really help us to feel like we want to get out of bed in the morning and kind of seize the day. That's testosterone. So it is estrogen, but it's also so many other things that really kind of create this perfect sort of hormonal balance that we all seek to have in our lives.
And a little bit about you too. I was reading that it all started in 2010 when you had finished medical school and you were going to begin your primary care residency. But there was something that you said you were miserable. There was something about you wanted to be in medicine, but this path wasn't feeling right to you. It wasn't resonating. Tell us about that.
Yeah, I'd wanted to be a doctor since I was 5 years old, and I don't know how I got that idea. There was no one else in my family who wanted to be a doctor or who was a doctor. No one else was in medicine, but I just really wanted to do this, and it was kind of this straight path that I had, and I never really deviated from that. So when I finished medical school and I started my primary care residency, I couldn't believe how miserable I was. I couldn't believe that this was the way that I was going to have to be practicing medicine. It was everything was based on medication and really treating symptoms, and there really wasn't anything, outside of that. That's really how we were taught in medical school and residency, is to treat symptoms. And it just wasn't the way that I wanted to practice medicine. So I left my residency not knowing what I was going to do. And I had already been out at Loma Linda here in Southern California for my master's in public health prior to starting medical school. And it was there that I landed on a preventive medicine residency. And we think that, doctors should be focused on preventing and reversing disease, but really we don't have that focus at all in our training. And so when I found this residency, which there are these preventive medicine residencies all over the country, Johns Hopkins, UC San Diego, big institutions have preventive medicine as a residency, but we as medical students that's not really advertised to us. It's not really like a focus of, all of these people are going to preventive medicine. It's not something that's really on our radar. So when I sort of heard about it, I thought, this is what I want to do. This is exactly up my alley. This is exactly what I'm looking for. And unlike my primary care residency, from day one when I started Prev Med, I knew I was in the right place, and I knew that this is how I wanted to practice medicine, and that's really how I've been practicing ever since.
Now, is preventative medicine what you were studying in during that residency, is that the same as like a naturopathic?
Yeah, so naturopathics, they have a completely completely different medical school. So they come out, their whole training is totally different. So they really start out in naturopathic medical school. We start out in medical school where we get an MD at the end of our training. They get an ND at the end of their training, which is different. So their education is different, but preventive medicine for MDs is really about preventing and reversing chronic disease. So we learn how to prevent and reverse diabetes, for example. We learn how to get patients off of insulin, which is crazy. That's never something that is part of, sort of how typical medical students learn. Our education is very uniform throughout medical schools throughout the country. So every MD who's coming through medical school and graduating from an allopathic program, they're all learning the same thing. It's all about the boards. It's all about, teaching to pass the board exams that we all take. So it's a very uniform thing. But once you get into residency, that's different, what you learn. But it was just, here I was in a place where I thought, this is how patients want to, they don't want to be on a million different medications. They really want to figure out what's going on and make sure that doesn't happen for them. So whether it's high blood pressure or insulin resistance or depression or anxiety or difficulty sleeping, all the things that I see in my office, patients don't want to be on lots and lots of different medications. They want to figure out why they're having that and change whatever needs to change. And hormones are really at the foundation of that. So, I started my practice straight out of residency when I finished at Loma Linda and have been doing menopause and perimenopause management and preventive medicine care ever since then. And I love what I do. And I really feel like there is starting to be a movement where doctors aren't typically happy in sort of this silo that they are living in right now, where they're kind of dictated by insurance companies and, what they can and cannot do. I think more and more MDs are sort of going into, this type of medicine where they're, really trying to change the way that medicine is being practiced. And I think it's for the better, for sure.
Well, I know in reading the book, too, which is fantastic, by the way, as someone that has been through all of these things, thyroid,
yes.
Medical menopause, and in my 30s, just endometriosis was the root cause of that one. But and then just this whole journey, but also understanding what I love about the book is the fact that it's really empowering. It's teaching, you're understanding. It's not just a book about hormones. It really is a manual, and it's so funny. And you write in the beginning of the book about how we have a manual for everything: our electric toothbrush, our car, our everything. But of course, when it comes to life and our health, that's not always the case. And I know we always ask for the manual on parenting. We're still looking for that one. I think on hormones, you really nailed it. And with the patients that you've been seeing, is there a common denominator or something that, gosh, if we only knew this, if the women only knew this piece of it, I'm guessing that's what brought this to the forefront for you. It's really not that difficult once we understand and educate, which is what you've done.
And that's really how the book was, sort of the inception of the book was I had women sitting in my practice saying, I can't believe this information you're telling me. I've never heard this before. You have to get this on paper. People need to know about this. So that was really how the book began. I didn't really set out to be an author. To your question about what is it that I would really love women to know, I think anxiety and depression are sort of like the biggest, life-impacting things that women experience that they don't typically understand. And usually, you go to your gynecologist, that's typically like the doctor that women have that they keep them sort of through and through until the end. And, they're complaining to their gynecologist maybe about their anxiety or depression. And then they inevitably will see a psychiatrist. That's kind of typically how things will go. Or maybe their primary care physician will manage it a little bit. But for women, anxiety and depression is so much related to their hormones. It's related to the imbalance of estrogen and progesterone, typically. So I would love for women to really think that when they are suffering from anxiety and depression that's out of the blue, it's not caused by some specific event, that's a different story. But if it's sort of out of the blue, and especially if it's related to their cycle, if they're having these mood swings and then all of a sudden, they get their period and they feel like a completely different person, they feel so much better, then their anxiety and depression is completely linked to their hormone imbalance. Having your estrogen and progesterone in just the right sort of combination, the right ratio, is so important to feeling like your mood is stable. And I just feel like there's so many women walking around all the time trying to deal with life who are in the throes of anxiety and depression, and they really don't know what to do. And they're on, different anti-anxiety meds and different antidepressants, and they're having side effects from those and gaining weight, or their libido is crashing, or whatever it is. And it's so much about the balance of hormones when it comes to that particular symptom.
Well, it feels like sometimes, in a kind of a joking way of saying, it's like a double-edged sword. Not only is our body, as we age, our body is going to start adjusting. We can't avoid that. That's, death and taxes, our hormones in our body is going to start adjusting as we age. It's because we're not, we're getting out of that gestational period of life. But at the same time, there's so many external factors that can impact it. Our lifestyle, our diet, maybe those prescriptions that we're on. Yes, there's traumatic things that can impact us as well, but it's not even just the body doing what the body does, but then we start throwing those external variables in it that we do have control over that can help us.
Yeah, and I think also just kind of dealing with period issues like heavy periods or fibroids or migraines, all these things that tend to plague women that especially teenagers and 20-year-olds, they think, oh, this is just how my period is. That's just me. That's normal. But it's having these super heavy periods where you're bleeding out or missing school because you're in such period pain. That's not normal. That's not acceptable. And that's not something that women should think that, oh, that's just me. That's what I have to deal with. So I think that that's another thing that, listen to your body. Your body is creating symptoms to give you messages. It's kind of like a crying baby is giving messages to mom and dad of this is what I need. And that's what your body is doing when it is creating symptoms. It's telling you that something's wrong. I think that that's something that we, instead of sort of ignoring our symptoms or trying to suppress our symptoms, we really need to look at our symptoms as messages. And I also think, gut health is something that I talk about in the book, and that's something that is so important. I mean, you talk about, these external factors, what we take in by mouth, what we're eating, what we're drinking, whether we're popping Advil all day long, those things totally impact our gut health and our gut microbiome, and those things impact our hormones. I think stress is another big one. When we're under chronic states of stress, we're producing chronic amounts of cortisol. And cortisol, which is our stress hormone, can impact how our hormones are balanced when we're talking about estrogen, progesterone, and testosterone. So those are all things that we need to be really focusing on in order to kind of create like a homeostasis within our body, and in order to have balance and to feel as good as we can as we age.
Talk too about oral contraceptive pills. I mean, I know us and the girls in the 20s, when we first started that, what that is doing. I don't think we realize, I know when I was in my 20s on the pill at the time, didn't realize that was a hormone. Didn't really do the math on all of that, or like, what is that really doing to my body? Yeah. There's a contraceptive piece, but then the long-term effects or even short-term effects of it.
And I think birth control is still passed out for every symptom. A teenager comes in with period pain or heavy periods or migraines or acne, so many different symptoms. Oftentimes, birth control is what's given. And the problem with birth control is that it's totally cutting off the communication between our brain, how our brain is messaging our ovaries, and how our brain is telling our ovaries to make hormones. It's totally cutting off that communication. So it's kind of like, you imagine for a man, if we just cut off the communication between how the brain is telling the testes to produce testosterone, I mean, that would never happen. Men would never support that. But that's what what we're doing with birth control. So we're actually suppressing our hormones. We're suppressing ovulation. We're canceling out ovulation completely so that pregnancy does not happen. But there's so many effects from doing that. And one of the effects is that it suppresses progesterone, which is our own natural antidepressant. So often within a year of starting on birth control, women will start on an antidepressant and they really don't make the connection. So, and then we talk about infertility and all the women who are plagued with infertility and what happens with that. I mean, I think that a lot of that stems from years and years of being on birth control and really suppressing that communication. So birth control is readily available and readily prescribed, but I really think that we need to understand how detrimental it is to our overall hormonal makeup and how it can really have both acute effects and chronic effects.
And maintaining hormonal health, and when should we start testing? At what point? And then of course there's the whole, well, you're in the normal range, so you're fine, which is not... I mean, that's a number to look at, but it's not the number. Don't we want to look at the overall, like, how are you feeling and all of those things, which sometimes that gets dismissed from maybe our conventional physicians.
I think we should start testing when we have symptoms. So women should start testing when they have symptoms. If they're having symptoms in their teenage years and they're having chronic migraines and they're having, terrible period pain, or they're having anxiety and depression related to their cycles, that's a time to get their hormones tested and their gut microbiome and things like that. And really just to look at like the overall picture. Some women skate through and they have easy periods, easy pregnancies, no postpartum depression. And then when they get into menopause, maybe they'll start to have some symptoms. So I think we test when symptoms start to happen. And testing, the type of testing really matters. So many women will go to their doctor and ask to have their hormones tested. And sometimes doctors will say, I'm not going to test your hormones because there's nothing that we're going to do about it. And other doctors will test their hormones, but then inevitably their hormones are within range for that particular lab. And so then, women are sort of left like, okay, well, I had my hormones tested. Everything's within normal, so it must not be my hormones. Now what is it? That happens all the time. So finding you have to have the right provider to treat the right thing. It's kind of like I say in my book, you're not going to have a plumber do your electrical work. You have to have the right provider who understands hormones, understands the nuances, understands the different testing in order to analyze and treat your hormonal imbalance. So, there's specialty at-home test kits that are really important that are based on the cycle. Or if they're in menopause and they don't have a cycle, then there's specific times to do those, but, they're very specific hormone tests that are done typically at home, whether it's a urine test or a saliva test or something like that. And those are the tests that really need to be done. It's not just your basic blood panel where you go to your local lab and you get your estrogen, progesterone, and testosterone checked. So I think that that's something really important to understand is you've got to find the provider who practices bioidentical hormones, who understands perimenopause and menopause, who understands the hormonal imbalances and knows what the right tests are to use.
Who do you want reading this book? Who is this for, Dr. Taylor?
It really goes through every decade of life, starting even in the first decade of life. And it really sort of walks women through how different symptoms are related to different things from a hormonal perspective. So really sort of for everyone. It's for the mom of a teenager. It's for the postpartum depression patient. It's for women in their 20s who are suffering from migraines or acne. It's for the menopausal woman, and then I think it's important for men to understand, what women are going through, what their teenage daughters are going through, what their wives are going through. It's sort of for everyone.
And men aren't exempt. So if they're thinking that they don't get affected by hormones as they age, we're going to tell you.
They absolutely do. I see a lot of men, and I tell you, when their testosterone drops, they feel like a completely different person. So getting testosterone balanced for men is super important for for health and mood and vitality as men age. So they go through their own menopause issues. We just don't typically talk about it. But yes, they are not exempt. I would agree with that.
Well, and I find the book, like I said, very empowering and educating. I think that's one thing that surprised me even today, how things that you're not going to necessarily get from conventional medicine, which is even nutrition education or looking at the overall body, the overall wellness, preventing things, when I assumed that is what doctors should be knowing. And so that is something that, like I said, just that information and empowerment and understanding how the system works, if for lack of a better word. I've talked to physicians that have gone through medical school and then said this didn't feel right and went into that preventative or naturopathic path, understanding like, wait, the overall wellness, the overall body needs a better look than what we're giving them. And I don't know that we the patients, really understand that this is out there, that doctors like you are out there. So I think this manual, the hormone manual specifically, a straightforward guide for every woman at every stage of life, is so important and getting this word out. So I thank you for that.
Thank you. Yeah, it's an honor to be able to talk about it and, really to get the word out. And I just think awareness is really the first step. So I'm really hoping that this is what this book provides.
And Dr. Taylor, where can we go to find the book and learn more about you and your work? If I'm looking at the information correctly, that you do telehealth, so people can reach out to you pretty much from anywhere.
Absolutely. Yeah. I'm licensed to practice in the state of California and Tennessee. So if you're in those two states, I can certainly see you. And even if you're in other states, you can still come in the office and see us in person and still be a patient. The book is available on Amazon and at Barnes & Noble. People can sort of find out about us more through the website at julietaylormd.com. And then, of course, follow us on Instagram at julietaylormd.
Well, again, I appreciate this time and this work. Thank you.
Thank you, Dawn. Thanks so much for having me.
Hey, thanks for listening to the Dawn Newton Podcast, and a special thank you to my guest, Dr. Julie Taylor, joining us today to discuss her book, The Hormone Manual, a straightforward guide for every woman at every stage of life. For more information about Dr. Taylor, to find her book, learn more about her work, and even contact her, julietaylormd.com is the place to go. And be sure and check out my website, dawnnewton.com. The Dawn Newton Podcast is written, produced, and hosted by Dawn Newton.